Learning more tonight about Roanoke's latest step toward combating opioid crisis.
I told you yesterday the city council gave the go-ahead for a comprehensive harm reduction plan, which includes that controversial needle exchange program.
One of the biggest critics in the past, Police Chief Tim Jones, now giving his stamp of approval.
And so 10 News reporter Jessica Jewell is in the studio with more on why the chief has had a change of heart. Jessica?
Well, a lot went into this change of heart. Certainly not an easy decision to get Chief Jones to back this. He told me today the first time he read an email about this program, he flat out said nope. But after months of collaboration and negotiation, he's on board with a plan many are still skeptical about. And tonight, he's telling us why.
One of the first things they tell you when you're swimming is make sure you know the depth of it before you jump in.
Roanoke Police Chief Tim Jones certainly didn't dive into the initial proposal for a needle exchange program.
I cannot sign something that asks me to condone felony behavior.
Turning it down and taking some heat for it. He saw the pros for public health, letting people swap dirty needles for clean ones, but also saw major cons for public safety, potentially asking his officers to turn a blind eye to illegal drug use.
So if I pump the brakes over that process, I think as a police chief, that was probably sound reasoning for doing so.
Back to the drawing board.
We were kind of at an impasse for a while.
Jones worked with the drop-in center's Colin Dwyer and other stakeholders to bridge the gap.
It's been a success.
Without giving us specifics, Jones says he's confident the city council approved comprehensive harm reduction plan will help people in need and keep our neighborhoods safe.
We took extra care to try to minimize opportunities for abuses within the free needle exchange component.
And that's just one piece of the puzzle. The plan is to send 2 mobile units to different locations each month and connect registered participants with resources for mental health and substance abuse treatment. A broad approach with a pioneer program to tackle a growing problem.
Our model may become a model for other places to utilize, and I hope it does.
This program still has to clear the Virginia Department of Health. Organizers hope that once that happens, it can launch here in Roanoke in late July or August. In studio, I'm Jessica Jewell, 10 News, working for you.